The first several chapters, probably about the first 4 or 5 chapters, the PowerPoints are going to be fairly detailed, and I'm going to be using a lot of images from the textbook in order to display up on the PowerPoints. And then after that, kind of gets repetitive, and we just kind of change topic, but we're doing the same thing over and over again. So the PowerPoints will become less and less visual, and we'll probably rely on them a little bit less. And also at that point, our conversation is going to shift from learning the basics of medical terminology actually over into the medical field and answering some questions and talking about your guys's desired career paths. Just gonna adjust my camera a little bit there. So what do you need to know, or why do you need to know medical terminology? Well, you guys all want to work in a medical field to some extent, or you're interested in it, so you're checking it out. You absolutely need it in a medical field. I never had a base medical terminology course. I did have a science background coming into my medical training, which helped me immensely with the nomenclature or the medical terminology aspect of it. You will learn a lot of it just from being in a medical field or a medical program. However, if you have a foundation of medical terminology, so you'll pick up a lot of information just from being in the field, but having a foundation of medical terminology before you jump into a medical program is going to allow you to learn that information faster. So it prepares you to learn the information that you're going to be provided. I teach in a medical program, the respiratory care program, and what we expect when we accept students into the program is that they're ready to go. They've got anatomy and physiology background, they've got a minimal understanding of how the body works, as well as how to speak the language. And then there's a lot of information and language that is particular to our field that we have to update students on. And that's understandable, and of course we do that. But when we say something like a red blood cell count, we expect people to understand what that means. Or when we say pneumonia or hepatitis, we have that expectation that the students understand that already. Now, there's some terms that are unusual or uncommon, and of course we explain those terms and we go through all of that. But you will find that your instructors in programs are going to expect you to guys have knowledge, pre-existing knowledge of medical terminology. So it's very important. So you've got to be able to speak in that language to some extent going into a medical program. And then obviously once you get into the career field, you're going to have that ability, but you're always going to be learning. Trust me, there's words that I come across every single day in my profession that I've got to go and look up because I've not heard it, or it's new, or it's just not something that I treat all the time. So it's not a matter of having to memorize every single term that's out there and having expert knowledge in everything. The whole point of learning in general is so that you understand how to learn. You have the skills in order so that when you're presented with something, you can understand that new material. You may not know it, but you can then understand it as you're going through it. And I tell our students this all the time. You guys are going to know all about the cardiopulmonary system, but then you're going to get in the hospital and you're going to learn something completely new. You're going to have information about the liver that we are not experts in, but you have the ability just to read the report and to learn that information because you understand how to understand something. And that's kind of where we're going with this. This is a building block to that education. Learning to think in medical terms is definitely important. And we'll talk more about this as we break down the actual terms into their parts and understand what that means. And if you've gone through chapter 1 at this point, you've seen a little bit about that. Learning to spot the relationships between medical terms and English words. This will be important as we will continue. Most of the words we're using are from Latin or Greek, and we'll see that a lot of our American terms or English terms actually come from Latin or Greek word roots. So that is going to start making a little bit more sense of some of the words, why we use the words we use today, because they actually come from these ancient or classical languages. And in doing that, looking up these word roots is important, but there's hundreds, thousands of them. So there's no expectation that you're going to know all of them. However, you're going to have to memorize some that you're going to use all the time, and others that you just use all the time, you're just going to learn. And then others you're not going to see, but having the knowledge of how do we break apart a medical term is going to give you the ability then to understand that medical term as you're moving through it. Some key points. If you have some type of flashcard system, that's great. If not, making flashcards is really a really good exercise. Anytime that you go over the material extra, it's going to help you. So if you read it, that's one time. If you listen during the lecture, that's a second time. If you make a note card and you write out the words, that's the third time. And then every time you go through those note cards, that just adds to your brain's ability to memorize that information and then understand it. There's a difference between memorization and understanding, and we'll talk about the differences in a little bit, but understanding is key, memorization is helpful. So in that, I would prefer you guys understand the material rather than just try to memorize the stuff that we're talking about. So this is the first major point that I want you guys to key in on, and this is on page 4. This graphic is on page 4 of your text, and it talks about it on page 3. But all of the medical terms that we're going to be using are going to fit into one of two categories. And if you look over on page 5, let me just scroll through some of this real quick to get to that slide. You'll see this chart. So you have two categories there. One, terms built from word parts, and then two, terms not built from word parts. And so when we look back at this graphic here on page 4, we see that what's built from word parts is the Greek and the Latin. So terms that are built from Greek and Latin word parts. That's category 1. The rest of those all fall into category 2. So eponyms or eponyms are terms derived from persons' names, usually a physician or a scientist who identified or worked on that. Acronyms. So for example, I've got there on the screen CPAP. That stands for continuous positive airway pressure. So CPAP itself is not a word, but each letter stands for a word, and that builds what we call an acronym. And then using modern language is typically something that is an English word that is describing something to do in the medical field. So 4 categories there, but those 4 items all fit into 2 broader categories. And that's what we looked at on page 5, table 1.1. Terms built from words, again, those are the eponyms, or sorry, not the eponyms, the Greek and the Latin words. And then you've got the second category, terms not built from word parts. That's the eponyms, acronyms, and medical language. So if we look at some of these just as an example, and for review, this is exercise 2, or an example of exercise 2 that's on page 4. So this is the type of thing that you would be going through in your text as you move through the chapter. So Parkinson's disease, for example, is an eponym because it comes from somebody's name. Hepatitis is from a Greek and Latin word, so hepat, and then it's got the suffix itis on the end of it. MRSA, methicillin-resistant Staph aureus. So this is a specific type of bacteria that is resistant to an antibiotic. And so it is an acronym because it is just, each one of those letters is a word itself. Post-traumatic stress disorder. This comes from modern language. So this is all English words that we're putting together. Arthritis, back to the Greek and Latin. And the more you review this information and we start going through this text, you'll be able to identify each of these a little bit more clearly, and it will become easier. So I'm just going to kind of scroll through the rest of these and you can kind of get an idea there. Okay, we just talked about this chart and these categories, but I do want to make a special point of this section over here, this learning methods. So how do we learn the materials that are in each of these categories? By far, category 1, the terms built from word parts, that's your Greek and Latin. That's going to be the most important, and those are going to be the highest level of use that we're going to see. And that is the science of understanding medical terminology, and that we have to analyze the term. We need to break it apart, and we'll see that when we add slashes, define those terms, and build terms. That's how we're going to learn how to understand what those category 1 or Greek and Latin words mean. The second is the rest of those categories, so the eponyms, the acronyms, and the modern language, or the English terms. Those, unfortunately, you just kind of straight up have to memorize, and through constant use, you're going to learn how to use those terms and what they actually mean. The more you use those terms, the more you'll understand them and be able to use them. So whatever career fields you happen to go into, you're going to have a specific subset of terms that you use the majority of the time, and you're going to be an expert in that. And then you're going to have a whole bunch of other terms that just kind of come in randomly and that aren't as used as much. And those terms you might have to look up from time to time. So in no way is the expectation that you're going to know every single medical term and be able to apply it in every circumstance. But we do want to learn how to understand medical terms so that when we see a new term, we understand how to find out its meaning. So memorization isn't the key point, it's learning so that we understand how to find out the information is actually the most important aspect. So 4 word parts. And we see this down towards the bottom of page 5 on your text is where this information comes from. So we have the word root, which is the fundamental meaning of the term. So that is the key, and that's going to give you the most information about what it is this term is about. And then the prefix is a modifier that is going to give you information that applies to the word root. So it somehow changes the word root in its application. Or, for example, might mean to go below the kidney or below the kidney, above it or below it, to the left or to the right. That prefix will help us in doing that. The suffix then goes towards the end of the term, and it is another qualifier that is going to alter the word root to some extent. And then combining vowels are simply parts of the language that we put into the word in order to make it easier to say. And we'll see good examples of that as we move forward. So some examples of word roots. So arthur, meaning joint, like as in arthritis, and the itis, that would be inflammation as a suffix, so inflammation of the joint. Then vein, hepat, liver, oste, bone. Prefixes like intra, so intravenous or intra-abdominal. That means within the vein or within the abdominal cavity. Sub would mean under something, so subcostal. Costal is the word root for your rib. So subcostal would mean underneath your rib. You could also go like supracostal, meaning above the rib. So that's how we see prefixes used. And then suffixes, we've already used itis a few times, so we know that means inflammation. Bronchitis, bronch meaning the airway of the lung, and then itis meaning inflammation, so inflammation of the airway. Ick, like in hepatic, pertaining to the liver. Us, percutaneous, so it pertains to the skin, the cute part of it, and so on. And then we can see the combining vowels, and the most cases it's an O. So being ostasis, osteoporosis, that's all just making it easier for us to say. In the English language, we can't just say venestasis, it doesn't flow correctly, so we go venostasis. This table, table 1.3, talks about word parts and combining forms. This is on page 9 of your textbook, in case you're looking for that. And it just talks about how do we use those in order to put them together to form our words. Guidelines for using combining vowels. This is an important aspect, and this is pages 7, 8 of your text, but it's nicely summarized in table 1.2. So when you've got a word root and a suffix, so the word and then what comes at the end of it, you're going to use a combining vowel if the suffix does not begin with a vowel. So for example, here we see arthropathy or arthropathy. You've got the pathy, which basically just means the study of the study of the joints, and then you've got the O. So because pathy does not start with a vowel, we use a combining form. We use this combining vowel. So word root and suffix. The next one is also word root and suffix, and it's just the opposite. So here, hepatic, we have ick and we have hepat, so the liver. Here, because ick starts with a vowel, we usually will not use a combining vowel in there. We wouldn't go hepatoic. Okay, it's just hepatic. It's a little bit easier to say in that way. And then the next one, 3, we're connecting 2 word roots. So the first 2 that we looked at was a word root and a suffix. This third one is 2 word roots themselves. And when we're doing that, such as oste, bone, and arthur, joints, so here we have bone and joint inflammation, we join those 2 word roots using a combining vowel. So it would be osteoarthritis. And that's typically always done whenever you're joining 2 combining vowels. I'm sorry, 2 word roots with a combining vowel. And then the last one is using a prefix and a word root. Now, the first 2 we used suffixes and word roots. The third one we used 2 word roots. And so now we're looking at the prefix and the word root. And typically here with prefixes, we do not use combining vowels. So sub is the prefix, hepatic. So below the liver is what we're talking about here. So sub and hepatic, there is no sub-o-hepatic. We're not using a combining vowel there. It's not necessary. Some basic rules about understanding medical terminology. All medical terms are going to have at least 1 word root. It's going to be really, really important that you identify that word root. And that word root is going to allow you to kind of figure out and place where is this term actually going as far as what I understand about it. So for example, pulm, P-U-L-M, that is relating to the lungs. Hepat, relating to the liver. Renal, relating to the kidneys. So finding out what that word root is immediately going to give you an idea of what is this word pertaining to. Now, I don't have the combining information, the prefix and the suffix to tell me what about that, but it tells me at least what system I'm in. So our example down here below, oste and arthur, that's telling me I've got 2 word roots, I've got bones, and I've got joints. So whatever this term means, it has to relate to the bones and the joints to some extent. Another basic rule is that not all medical terms will have a prefix, suffix, or a combining vowel. They typically will have one of those items, but they do not have to have all of them. And so that in classifying these medical terms is going to be important to understand that as well. They don't have to include all of these things, but usually one will be there. Usually, so not a global recommendation here. Not every single word here on this third point is going to be applicable to this. However, most of the time when you're looking at a medical term, especially if it's from the Greek and Latin, you will start at the end of the term and then work backwards. So you're going to start at the right-hand side, the end of the word, and move back left, which is the opposite way that we read, of course. However, this is going to help us to understand the word a little bit better. So a quick example of this is that osteoarthritis. So we see, if we go from right to left, we see the itis. So we know we have inflammation. Arthur, word root of the joint. O, we know is a combining vowel. It doesn't mean anything. It's just there to help us speak a little bit easier. And then oste is, of course, bone. So if we put all those together, we would say that then as we have inflammation of the joints and the bone, or the bone and the joints. But the key point there is that we wouldn't say, okay, this patient has bone and joint inflammation. Typically in the medical field, we would say the patient has inflammation of the bone and joints, or of the joints and bone. So sometimes we will put that suffix actually in front of the word when we're speaking out its definition or its meaning, and that's why we're reading it from backwards to forwards. A few terms do not follow that rule, and so we would actually be going from left to right or forwards to backwards, such as in melanoma. Now with this, if you look at it and if you went from backwards to forward, it's not going to ruin things. You're not going to not understand the meaning of it. It will still be preserved. It just may be a little bit easier to go forwards to backwards in this case. And you will basically be able to identify that as you go through the words themselves. But either way, you're not going to ruin the information of it. It's just a matter of how are you presenting it then once you say it or explain it to someone else. So in this case, oma meaning a tumor and melon meaning black for the coloration of the tumor. It would make more sense to describe this to someone as they've got a black tumor rather than saying they have a tumor that is black. Big scheme of things, does that really make a huge difference? Probably not. Okay, so don't get too hung up on those types of things. So breaking this down a little bit deeper, and this is really the heart of medical terminology. So if there's one thing you take away from any of this course, and particularly this lecture, table 1.4 is very key to that. And this is how do we break up the words and divide them in order to understand their parts. So far, we've talked about word roots, we've talked about prefixes and suffixes, and then the combining vowels as well. And so that's how we're going to break these words up. And so you can see here in table 1.4, which let's see, page, I think 11, nope, got to go a little bit further than that. Page 14 of your text has this table in it. So in order to analyze this word, in order to break it up, and this is what we're going to be doing the entire rest of this class, just with different systems of the body. So understanding this is hugely important. Please spend time understanding how to break these words down and then how to work through them in order to understand their meaning. Memorizing what pathy means or memorizing what itis means, memorizing what sub or inter means, intra, that's going to come as we continue to work through the material. But understanding the system of breaking these words apart is what you have to understand right here at the base of this course. So if we look at this first one, analyzing, we're going to divide and label. That's the essence of what this first part of the box means. So you can see the word osteoarthropathy that we have listed there. And you could do the same thing with osteoarthritis, that example we've been using, but here we've just added a little bit extra. So what we want to do is figure out where's my prefix, where's my suffix, where's my word root, and then where are my combining vowels. And you're going to put dashes between the word in order to identify that. And then using these abbreviations that are listed on the screen there, WR for word root, you want to identify what are your word roots in this word. And then do you have a suffix or do you have a prefix? If so, label it S or P. In this particular example, we do not have a prefix. We do have a suffix, however. And then we have two combining vowels. We have two O's in there, which aren't part of the word root or the suffix, yet they help us to say the word a little bit easier. And so that's called a combining vowel. And one thing we haven't mentioned yet is called the combining form. The combining form is simple. What it contains is the combining vowel connected to the word root. So you can see there under point 3, you have osteo and arthro, and you've got the little line joining the two of them together and CF written underneath the term. So you've got your word root and your combining vowel identified on top of the word, and then CF, the combining form, on the bottom. So the combining form is simply just your word root plus the combining vowel put together to join one combining form. So that's how you should understand that. So after we've divided and labeled the term, Now we're going to define the term. And remember, we're working backwards through most of our terms from right to left. So pathy, the suffix here is telling us that means disease. Now, how do you know what pathy means? That's something that you're just going to have to learn. You're going to have to memorize that. And because we use pathy 500 times a day in the medical field, you're going to understand what that means. But memorizing that right here in this class, first off, might take a little bit of time. And so some of these suffixes, prefixes, and word roots are going to just take that work to memorize. And that's where flashcards come in handy. But like I said, more important that we understand the process here than the individual words. If you have to go and say, okay, well, pathy, what does pathy mean? And then you got to go into the chart that's inside of our text to look at that. Great. Got no problem with you doing that. If you need to do that on a quiz, fine, do it. If you need to do that on a test, okay. I would prefer you guys learn the process and learn how to do this than me just testing your memorization. Okay? I'm not turning you out into the medical field after this course to treat people. Therefore, I care more that you learned how to learn this material than you did memorize the material. When I have my respiratory therapy students, I have to make sure that they've memorized it, that they learned how to learn it, and that they can apply it before I send them out. Because when I send them out, they take their boards, they get licensed, and then they start treating patients, including my family members and friends. And if I'm going to be putting my stamp of approval on them, that they can go out and treat those people, I'd better have made sure that they can do that and that they've got that information memorized. You guys are in a little bit of a different level because you're now just working into that program state. So I've got no problem with you guys just going out, not having every single aspect of this memorized, yet understanding how to apply it, the material as you come across it. So that's kind of a peek behind the curtain of my teaching philosophy at different levels of education. So again, working backwards, pathy. So we know that that's disease. If we had to look at that up, that's fine. And then we're just going to straight jump over to what the word root is, arthur. So that's the word root. We know that means joint. And then oste, we know that that means bone. So we've got two word roots. We've got one suffix. We know that we have disease and that it has to do with bones and joints. So then we just add the combining vowels in order to make that easier to say. So that's going to help us define that process, learning it and applying it as you go through your examples in the text is going to greatly benefit you. I'm going to switch my camera around here really quick so I can show you. Okay, so looking at your book then, this is page 13. You can see exercise 18. And then exercise 16 kind of helps us to learn how to do exercise 18. I highly recommend going through this type of exercise in your text. Just get a scratch sheet of paper, put it off to the side, and work through these words. Because every single chapter from here on out is going to have exercises like this that pertains to the words that are in and with that particular system that we're going to be learning. So learning that process right now is going to be really, really important. So please spend some time working on that if you haven't already. I would say that's, if you spend your time doing that now, that's going to pay the biggest dividends at this point in the course by far. The last box down here, this building section, how do we build words? This is kind of like reconstructing the word from its meaning. So if we know what the meaning is, for example, given their disease of the bone and joint, then that's where we have to reverse engineer this. So we know disease of the bone and joint. We would say, what word or what suffix or prefix means disease? So we would then look it up if you need to. That would be pathy. So we say, okay, we know we have pathy involved, and then we know we have bones and joints. So we've got word roots there, oste and arthur. How do we put those words together? And that's what building is actually doing. So The beginning of the definition usually indicates the suffix as listed here. And this is just another one of those sort of learning medical terminology quips that we need to start applying. So disease, pathy is most likely going to be our suffix in that point. So we know we're going to have bone and joint, pathy, oste and arthur, pathy. And then how do we combine those? We have to use combining vowels. Osteo would be your combining form. Arthro would be your combining form. Join those two together. Osteo, arthro, add the suffix pathy. And that's how we've built a medical term from its meaning. Some common prefixes and just some examples. So intra, the ra, the a means within. Sub meaning under. We also used the term supra earlier today, meaning over or above. Some word roots, and then also with their combining forms. So arthur would be the word root. Arthro would be the combining form, meaning joint. Hepat, hepato, meaning liver. Vene or veno, meaning the vein or the venous system. And then oste and then osteo, having pertaining to the bones. And then, of course, the suffixes, we've used itis quite a bit today. Inflammation, ic, just means pertaining to. Us and pathy, also used today a couple of times, meaning disease for pathy. And then us, also meaning pertaining to, just like ic. So in this case, we have two different suffixes meaning the exact same thing. So I'm not going to go through this entire section here, but I do want to do sort of a walk through a couple of these words just to give you an exercise of what this looks like. So if you haven't done those exercises in your text yet, this is basically the method that you should be working through them on. So we're going to start off by analyzing and defining a few of these words. And I've just got an example here. So we've got step one, add the slashes. So we've taken these words that are here in our list, and now we've said, let's add the slashes. So with arthritis, we've got the word root arthur, we've got the suffix itis, we put a slash through the middle. Intravenous, we know vein is our word root, we know us is our suffix, and intra is our prefix, so we need to separate those out. And we're going to do the same thing as you can see here on the screen with every single one of these words as we move through this, just separating them out. The words with the O's, the combining vowels in them, tend to be a little bit easier because you know, hey, that O jumps out and it should immediately say, this is sort of like a defining split. There's going to be a dash before the O and a dash after the O in almost all cases, except for when the word root itself actually contains an O. So like osti, because it actually contains an O, of course, you're not going to put a slash after the O between the O and the S of oste. So you got to kind of keep that in mind and consider that. But in most cases, if you put a slash before and after the O, that's going to separate either your suffix from your word root or your prefix from your word root. So that's kind of a nice sort of key into figuring that out. Step two, then we're going to label these word parts. So if we look at that first example of arthritis, then we just have the word root of arthur and itis as the inflammation. And so that's going to be the suffix. Then we're going to do step three, and that's write that word out. So starting from right to left, itis means inflammation, arthur meaning joint. And then if you did use the combining form, which is adding the O, then it still means the exact same thing. So note that the combining vowel added to the word root does not change the meaning of the word root. Remember, it's only there to make it easier to speak and not to actually change the meaning. So whether someone says arthritis or arthroitis, it doesn't change the meaning at all. Now saying arthroitis doesn't really flow very well, so we don't say it that way. We just say arthritis. Remember that suffix has an I, it has a vowel that it begins with, and therefore, according to our previous guidelines, we're not going to add the combining form to it. It doesn't need it. That was number 2 under those guidelines. But if you have a word like arthrosclerosis, So now you've got sclerosis and you have arthur. That starts with a consonant or an S. You would put an O in between that arthur and the sclerosis, and you would arthrosclerosis. Doesn't change the meaning, just makes it easier to say. And then building medical terms, this is going backwards. Now we know the meaning and we've got to build the term out of it. So if we look again here, inflammation of joint or pertaining to within a vein, and we look at that, we would just build those out. So inflammation, itis, that's the suffix, joint, arthur. Pertaining to, within is the key there. It's within a vein so that we know it's intra, that's your prefix, vein, venous. Inflammation, itis, bone, oste. Inflammation of the bone, osteitis. And again, there we don't need a combining vowel because we have an I at the beginning of our suffix. And so on and so forth through the rest of this list, as well as the exercises in your text. So this is basically the same thing we've just gone through. This is, I think, page 13 or 14, page 13 in your text. You can see this example of the osteoarthritis and how that's sort of, what actually is osteoarthritis? Like we know it's inflammation of those items, but what does it actually mean to our patient or patient care? Well, when you have inflammation of the bone, then you've got two bones that are supposed to be connecting and articulating with each other nicely and smoothly. You've got connective tissue, you've got plates, collagen, elastin in there sort of to be suspension or cushioning in those areas. But if one bone swells, then all of a sudden it's going to be causing problems. Okay, that bone is going to have swollen and now nothing is going to work the way it's supposed to, and it's going to hurt your patient. And that pain is a good thing because it's telling us there's a problem in your body, we need to do something to fix it. Now, joint is just that space, right? It's not either of the bones, it's not the connective tissue, it's not the suspension system, it's not the collagen. It's just the space that defines where all of those things are meeting and taking place. So the arthur or the joint just means you have a generalized swelling in that area of that articulation point between those two bones. So you could have an arthritis, generalized swelling in that area, or you could have an arthritis, an osteitis, which is the bone swelling itself. Both of those terminologies mean slightly different things. Oftentimes you see them in concert with each other, taking place at the exact same time. And the result of that is pain and discomfort for our patients, in which case we need to give them something to reduce the swelling. Because we have itis, we have inflammation, it's going to swell that tissue or the bone. We need to give them something that is going to get rid of that swelling or that inflammation. So anti-inflammatory medications in that case is usually what would be prescribed. And change in lifestyle. So for example, if I'm typing 23 hours a day and I'm having joint arthritis in my wrist because I'm typing all day, I need to do something to not just treat that medically, but I need to modify my lifestyle so I'm not typing 23 hours a day. I need to change the thing that's actually causing that, right? If I play basketball for 4 hours every afternoon and my knees are killing me, I need to find something a little bit less impactful than to play basketball 4 hours a day. So lifestyle modification is extremely important in medicine. If we would all do lifestyle modification when we had an issue, okay, kind of an ambiguous number here. I don't have statistics to back this up or data, but about 90% of all of our issues would go away if we would change the way we eat, and if we would change some of our habits like smoking, drinking, drugs, and if we would get proper exercise. Our body is designed to take care of itself, and it will heal itself in almost all cases, even with some really crazy diseases like diabetes. If you just change your lifestyle and your diet, you can effectively eliminate diabetes, type 2 diabetes anyway, in most patients. However, the American sort of medical system is, hey, let's prescribe you a medication and you can take all of these medications and then continue to live this harmful life that you've been living. So it's not ideal. Okay, it's kind of is what turns our medical wheels right now, and it's great for big time pharmaceutical, and it's great for hospitals and physicians and healthcare providers in general, because it keeps people coming to us, but it's not what is best for our patients. Now, it's great for them short term until they can make those modifications, but if they never make those modifications, that's where we see, 40 and 50-year-old people who are obese with 5 and 6 different diseases, and they're taking 15 different pills per day, and they're spending $2,000 a month on medications so that they can continue to eat the way they want to, continue to live the sedentary lifestyle that they want to, and just eat pills in order to keep their body alive, instead of actually changing their lifestyle in order to let the body take care of itself. All right, I won't delay on that topic any further. The summaries are good at the end of the chapters. So it's the chapter review. Chapter 1 review starts on page 15 and jumps over into page 16. And I'm just going to switch my camera around and show you guys that one more time. So in the text, here we go. So these yellow terms here, those are kind of your headers throughout the chapter. So review of categories. We know we've got those 2 categories that I mentioned earlier. Review of medical terms built from word parts. We've got those different terms. So if you're in a pinch, or honestly, sometimes I like to do the review, the chapter review, before I actually read the chapter, because it helps me see where the destination is, right? If I know that, like, I'm going somewhere that day, I don't just jump in the car and start driving. I say, okay, well, where am I going? I'm going to Lewistown. Well, in that case, how do I get to Lewistown? I don't just get in my car and drive any direction. I have to look up, how do I go in the right direction to Lewistown? And these chapter reviews oftentimes will sort of give you the roadmap of where you're going. And it may, in fact, make you understand what you see along the way as you travel through the chapter a little bit easier. And then it continues on to the next page, onto page 16, and ends with a review of the objectives, basically saying, can you answer the questions that we set out to answer at the beginning of this chapter? Either yes or no. If you find that in some cases you're saying no, that means you need to go back and review that particular section of the chapter. And then lastly, as mentioned in the previous video on the introduction, all of the answers for the exercises inside of your text are listed at the end of each chapter. So here, page 17 lists all of those answers for all of the exercises. And I'm not going to dissuade you from using that section. If you get stuck in a particular exercise, use the answers in order to help you through that. There's nothing wrong with that. Email me, ask me questions, but if you haven't read the text, if you haven't watched the video or attended the session, and you haven't looked up the answer to see if you can find it yourself, then I'm going to ask you those questions. Okay, I'm going to be like, okay, I'm assuming you've done these things. If not, you need to go do those things first before asking me. Now, if you've done that and you say, hey, I looked up this answer, this is what it says in the text, this is the question, I don't understand why that's the answer. Like, I get that's the answer, I just don't understand why. That's when you should email me to get further information. Of course, assuming that you read the chapter and watched the video, because I may have already explained that. But if you're still like, hey, this one term is just throwing me off, I'm not sure why it is the way they're saying it is, that's when you should contact me directly, and I'll talk about it specifically, that one term, to you at that point.
I did have one question. How do you know what order the root words go in? Or whether or not to use the IC for pertaining to, or the OUS?
Um, yeah, a lot of times that's basically just what sounds proper. So if you think about hepatic versus hepatis, um, you wouldn't be wrong either way. But if you go into the hospital, everyone is saying hepatic. So you might see that there's regional differences. You might go to Canada and they say a term slightly different. If you go to Europe, they're going to be saying things different over there. Pronunciations are the same way. We say trachea here in the States, but if you go over to Europe, they say trachea. So, we're not going to get hung up on those types of things, but it is a good question. How do you know which one to use? Most often, the answer to that is where do you live and how is it commonly used? So that's kind of an application aspect of it, to where you just have to jump in and start using it and listen to those around you and see how they're using it. And then that's going to guide you on how you're going to use that. Really not a scientific, this is every single time apply this and that's how you use it. And so that was one part of the question. Was there a second part of the question?
It was which order the root words go into. So like with osteoarthritis, why did they decide that bone went before joint rather than joint before bone? Is it the same thing, just sounds better?
Yeah, exactly. So
okay,
try saying the word arthroosteitis, osteoarthritis, arthroosteitis, or osteoarthritis. Again, you're saying the exact same thing. Technically, you wouldn't be wrong in either situation. So it's common to just go with what is most commonly used, as well as what flows better. So osteoarthritis as opposed to arthroosteitis. And I kind of have to stop and think about how I'm going to say that. You could see me actually processing that in my brain, because nobody says that in the medical field. So in almost 20 years of working in the medical field, I've never heard someone say arthroosteitis. It's just, it flows osteoarthritis. So short answer, there's really not a great reason other than that's just how it's always been said. And so that's how we say it. That may throw you off on some words. That may make you look funny sometimes, because you're like, okay, I think this is how it's said, and you say something to someone. Hopefully they'll be gracious and say, why do you say it that way? Like everyone else says it this way. And you're like, oh, well, I'm new. Obviously, if you're a student in a program, your teachers are going to graciously correct you. If you are at the hospital and you're going with therapists or nurses or doctors on rotations, and you say something like that, they know you're a student. Okay. Hopefully we're beyond the point, but you still probably will find some people that they want to pat themselves on the back and make themselves look good. And the best way to do that is to make someone else look bad and say, oh, that's silly. Nobody says it like that. Like, where did you learn that? And you might be like, oh, like, I'm ashamed that I even said that. Most people aren't going to do that. So ideally anyway. And so they'll graciously sort of correct you in leading you into that. Any other questions? All right, thanks. Start working through those exercises in Unit 1 if you haven't, and then start reading into Chapter 2, and have a great day.